statistics of work. Then alcohol, various types of alcohol that we see. Then misuse of prescription drugs is now considered to be a big problem. Now, prescription drugs would be, say, I write somebody for X. The person starts taking it and gets onto it for the whole of life. Spasmoproxima tablets. These tablets are used as painkillers. People use it for pain, get some high, and they keep on continuing. Then they have sedatives. Like a person doesn't sleep, takes a drug, helps with sleep, and a person takes it every day and gets very good. People put iodines on slices of bread and consume. These are prescription drugs. Then we come to some illegal drugs like heroin, opium, weed, etc. etc. Then one thing that is now popular among children is sniffing of volatile substances. You know whiteners. Then while doing paints, they have diluents. So people sniff it, they get a high on it. And it has disastrous complications. You know, we see small children, particularly from the slums, sniffing these volatile substances, eventually dying suddenly on a particular day because of heart attack, or they have a permanent brain damage. Then you have party drugs, variety of them, and they are available throughout India. Now my message to all of you is that please don't experiment with these. Never ever experiment, because you never know whether you will remain a social user or you will go into substance abuse. So there are no factors that say that you are going to become an alcoholic or say a drug addict. So this is my humble request to you and a warning to you that never ever experiment. It's not good. You know, recently I was working with students of SMS Maharajan Savai Manasingh School. They had a project on alcoholism, and we had visited Bhutanese addiction center, the addiction center, and they had a performer, the little girls built, and we were surprised to know that around 66% of the addicts they consume for the first time because of peer pressure. लोग आपको कहेंगे यार एक beer तो लिमिट्स में गया.
So this particular thing is the middle cause of alcohol consumption in college of schools also.
Yes.
Because at least 1% or the other by side now also is putting a pressure on you that you should try for once at least.
Yes. That's what I am trying to tell you. That this is nothing to experiment. Nothing to experiment with that. Because if you get addicted to that, then the journey is very difficult. Very difficult. Okay, so these are just some statistics from WHO, because if you are discussing a problem, you should know how grave it is. So 185 million illicit drug users globally, 2 billion alcohol users, and 1.3 billion smokers. If they are using it, what is the harm? Look at the mortality. This is the percentage of all deaths worldwide. Tobacco would cause around 9% of deaths worldwide, alcohol would cause around 2%, and other drugs would cause around 0.4%. It's a pretty big figure statistically, and hence tells you it's a big problem. We have statistics from India, and they are similar to this. The only problem is that in India, we are not research oriented, we don't keep our records well, so the exact statistics is really very difficult to tell, but it is a big issue, a very big issue. Substance abuse in youth. Do you know the minimum age when a person starts to have a drink? It's 13 years. This is from Kerala. It was a survey done. And at 13 years of age, people start. I see in my practice people starting as 10 years of age also. And by 20 years of age, 25 years of age, their liver is gone, it is totally damaged, they have cirrhosis of liver and they die prematurely. Consider a 35 or a 25-year-old person dying and not knowing that he is suffering from a disease called substance abuse. Also think that the doctor also doesn't know that he suffers from an illness called substance abuse. He is just concentrating on the physical problem that he has. 3 years back, I was the same. I wouldn't understand. I would just think it is a disgrace. That person is bad. He is mad because he is taking alcohol. Now I understand that, and you would consider it a hopeless situation. You would say इसका कुछ नहीं हो सकता है. आप फैमिली मेंबर्स को बुला के डांट दो, आप उस पेशेंट को डांट दो, उस पेशेंट से ढंग से बात नहीं करो, उसको अवॉइड करो, because this is a lost situation, a hopeless situation. However, 3 years down the line, since I came into contact with few people, and now I understand that there is a lot of hope if people suffer from this illness or a disease called substance abuse or alcoholism. There is hope. People can be dealt with in a humane way. They come out of this problem, they strive to come out of this problem, and they remain happy. So, there is some hope. Rather, there is a lot of hope that if people you know who suffer from this illness, you can give them a message and look, you should try and come home. At least you should try. So, these are the figures that we have from an NGO, and look at this. By the time most boys reach the 9th grade, about 50% of them have tried at least one substance. Be it alcohol or tobacco or volatile substances. 20 million children a year, and nearly 55,000 children a day are drawn into tobacco addiction. Look at the US figures, it's just 3,000. And we have 55,000 children drawn into tobacco addiction. 13% of the people involved in drug and substance abuse in India are below 20 years. Alcohol, heroin, opium, cannabis and propoxyphene are the 5 most common drugs being abused by children in India. It is not only children but youth of your age group also. Now, why do people take this?
So, one question I would like to ask is, so, what basically is the reason that the range of data is, there is great variation in the data. 3,000 students, 3,000 children are getting into the trap of drug addiction in US, while 55,000 per day in India.
No, this
so,
is not,
basically, is it availability?
This is not a statistics difference. This is population also. There is such a wide difference in the population. So, what we are trying to say is, look at the problem. Look at the problem that we have.
Sir, what I wanted to ask is the graveness of the problem is same in US or in India, or what exactly is the difference? Is it the population difference, or is there, or the situation is more worse in our country than in the Western countries?
That is what I am trying to say, that there is a dearth of, the statistics. The dearth of statistics. What we thought was that this is a problem of the developed countries. Addictions, alcohol, tobacco, drugs is not a problem in India. Now, these NGOs who are working with substance abuse, alcoholism, etc., are trying to tell you, look, this is a big problem in India. Why it is a big problem in India, we'll see.
Yes.
Okay. So, why substance abuse at a young age? Number one, to get high. You all understand what is high? Do you? Yes. Number two is to treat pain. So, if you are suffering from pain, you take alcohol, you start feeling good. Or if you have some exam and you are stressed up, you take alcohol, believing that it will increase your concentration power. will increase your performance, youthful, energetic, you can exercise, you can get up early, you can develop good habits, eat good food. ये सब चीज़ें लगती तो ऐसे ही कि क्या कोई भाषण दे रहे हैं, पेरेंट्स भी यही कहते हैं, टीचर्स भी यही कहते हैं, नहीं कहता है। But it is difficult to practice. मैं आपको बताता हूँ, आप इतना पढ़ते हो, आप आधा घंटा एक्सरसाइज करो, ठीक है? You have a great life. Rather than finding solutions in chemicals. Chemicals are not going to help. Never.
मैं बात बोलना चाहूँगा, डॉक्टर साहब जैसे कह रहे हैं कि पेरेंट्स बोलते हैं, सबके घर वाले बोलते हैं ना, नहीं बोलते। उन घर वालों के बोलने में, जो हमारे रिश्तेदार उनके बोलने में, या हमारे टीचर्स के बोलने में फर्क है। और हम लोग एक दो तीन उनका अपना पर्सनल एक्सपीरियंस है कहने का सब। डॉक्टर साहब और मैं ऐसे लोगों से डील कर रहे हैं, आप लोगों की जिंदगी में ऐसा नहीं आ रहा, हम लोग डील कर रहे हैं, हमें मालूम है प्रॉब्लम कैसे जनरेट होती है, वो कहाँ आके रुक करते हैं। घर वालों की बात में तो लोग जानकारी लेते हैं, इनका काम है, हम कर रहे हैं, इनका काम है बोलना,
हमारा काम है दस निकालना।
हाँ होता है। तो बहुत डिफरेंस है। ऐसा लोग जो प्रोफेशनली डील कर रहे हैं उन लोगों से, उन्हें काम आदमी से भाषण सुनना बहुत फर्क है। ड्रग्स उस समय बहुत नाम हुआ, अर्ली एज में ब्राउन शुगर ज़्यादातर शहरों में होगा, गाँव में होगा। और जो हार्ड ड्रग्स हो रहा है, लाइक कोई इंजेक्ट करने लगा, चरस खाने का सेवन ज़्यादा होने लगा, तो लोगों ने सोचा ये ज़्यादा नुकसान कर रहे हैं और अल्कोहल कम नुकसान कर रहा है। जैसे जैसे हमारी सोसाइटी मॉडर्न होती है, अभी क्या होता है